Hey everybody, Dr. Reviso here, and in this video we're going to talk about the cardiac cycle. So you can see this is a really big video. I think this is a really good place to also bring in heart sounds, kind of integrate this all together. We'll talk about the jugular venous waveform. A lot of these topics are things that, are kind of difficult to understand unless you're putting it all together. So I think it makes sense to kind of have this all in one spot. And then we'll talk about how do different disorders affect these different diagrams and curves. And so let's just jump right in. Okay, so let's just start off with the bare bones basics here. So when we're doing auscultation, what are the areas we want to be familiar with? So the aortic area and pulmonic area are both second intercostal space. The aortic area is going to be on the right of the sternum. The pulmonic area is on the left. The tricuspid post is going to be down a little bit further, fourth intercostal space on the left, again peristernally. And then the mitral area is probably the most high yield of all these areas to remember because there's so many different things that kind of happen in this area. And this is going to be the fifth intercostal space, again on the left side, midclavicular lines. And then we have this Erb's point, which is a really good point just for making a general assessment of any murmurs or abnormal heart sounds. Okay, so it gives you kind of a good idea of what's going on. That's usually going to be a third left peristernal intercostal space. Okay, so that's going to be that region between the tricuspid and the pulmonic valve. So if you get a question and they say, okay, we have a, you give you a patient, and let's say that the patient either has a regurgitation murmur, okay, or they have a stenosis. Okay, so for example, if a patient has pulmonic regurgitation or pulmonic stenosis, where are you going to listen? You're going to listen at the second left peristernal intercostal space. Okay, so that's pretty straightforward. Or in a board question, if they tell you that they're listening at the second left peristernal intercostal space, they're talking about these pulmonic murmurs, right? Most likely. Now, again, you can have this happen at the aortic area. You can have aortic regurgitation, aortic stenosis, pulmonic regurgitation, pulmonic stenosis, right? Tricuspid, mitral. You know which area you're going to listen to. So that's kind of the theory. It makes sense. If you're listening for a murmur that has tricuspid in the name, it's probably going to be at the tricuspid post. Okay, so if it's a tricuspid stenosis or regurgitation, most likely they're going to tell you they're listening at the fourth left peristernal intercostal space. Now, the thing that I want to add to that is there's like one additional murmur for each of these that you should be familiar with that's not as easy to remember, with the exception of the first one. So the first one is aortic coarctation. Remember, that's going to be narrowing of the aorta. So aortic coarctation, very classically listened to at the aortic area. What about the pulmonic area? The classic murmur for this area is going to be an atrial septal defect, okay, which is going to be a wide fixed splitting S2. We'll talk about that in this video. In the tricuspid area, classically the ventricular septal defect. This is where you'll usually hear this holosystolic kind of harsh murmur. The mitral area is going to be very classic for mitral valve prolapse. Okay, and we'll also talk about that. And like I said, Erb's point in general is kind of good just for making a diagnostic assumption of what's going on.